how is your organization adapting its messaging and services to meet the heightened expectations of today's consumers while remaining aligned with your core values and mission?
We actually rebranded and revised our mission, vision, values. Our branding and our messaging, it's all about authenticity first. Like, you need a strong foundation, but then we really have to think about context. And we think a lot about how do we, engage to meet patients' modern consumer expectations before, during, and after. We want a relationship.
What are those modern expectations?
So I would say that the patient's expectations are actually shaped outside of healthcare. We need to look outside of our industry to understand those expectations. And then we do a lot of direct research with patients to understand how those expectations show up, how do they envision us solving it, and then sort of co-creating.
Molly, since the patient experience doesn't begin at the bedside, how do you build trust with patients and view them as partners before they even come through the door?
I feel strongly that the patient should be driving, the experience. If the patient isn't a part of that solution and the problem definition, then your solution set that we come up with in a boardroom or in a conference room is really no good. It's just not going to resonate with the patient.
What do we do to measure and solve for the right things faster? I mean, Are we really getting what we need in terms of intelligence from our patients so that when we're told what we could have done better, they were actually in alignment with what really mattered to them?
If you're not measuring before you're running out your marketing plan or business plan, if you're not measuring during and making those adjustments, and certainly if you're not measuring at the end of it, and then creating that whole loop to make that change applicable to whatever you're doing, to revise your plan along the way, you're not being flexible for the patient. The consumer is really in charge, and we have to understand we have the tools in place to listen to their needs.
What does it mean for healthcare leadership to stop ruling by standards that don't account for what matters to the individual?
There's principles of change management there that is applicable on how do we start changing and pivoting and listening. And some of it is training our teams to have that active listening skills and that comes from the leaders, so that they can also pivot and listen to the feedback that their teams are giving, that the patients are often providing. And a lot of times you empower your teams to make decisions that aren't always standard. So I think there's a lot of foundational aspects to communication. And there's a cultural shift too of the way that we conduct any type of communication. And again, I think a lot of it goes back to, you've got to be able to pivot and train your teams on how do I recognize those signs that I do need to stop and I need to listen.